What's up, YouTube people? I figured I'd make an update video after I've had my appointments with the surgeons. I met with two surgeons, and I did that because I wanted, obviously to get a second opinion. I wanted to make sure there was a consensus between the two. So the first one I met with a few weeks ago, um, he pretty much determined pretty quickly that I needed surgery. I would have liked for him to ask a little bit more questions and not come to that conclusion so fast, but it's pretty apparent at this point that that's what I need. I've been dealing with ulnar nerve issues in my right arm for 5 years and my left arm for a little over a year now. So, but he said, I would be, he recommended I do ulnar nerve transposition. He does a subcutaneous one where they take your nerve from here, put it up here. Subcutaneous, all that means is they put it on top of the muscle. There's also a submuscular one where they go underneath your forearm muscles, and an intramuscular where they do it within. The way he does his subcutaneous is he just moves it here and leaves it there. He doesn't do the fascia belt to kind of keep the nerve in the new place. If all fascia is, muscle fascia is, if you think of your muscles as a sausage, there's an outer casing to your muscle called the fascia, and they use some of that to secure the nerve kind of in the right spot. He said something, that kind of worried me a little bit because I was like, is it going to move around? He said, well, when you move it here and you bend your arm, now it's no longer being stretched; it's actually being slackened. So, like doing this would stretch it out more, as opposed to this. I also was a little concerned because I'm pretty lean. I was like, well, if you just kind of put it on top, is that open to get hit, And he didn't seem to be worried about that. He says, oh, no, you'll have enough fat for it to stay there. And on some levels, I thought subcutaneous might be a good option if I had to do the transposition because I thought, for somebody that's active to do the submuscular, my fear was if it goes underneath the muscle and all of a sudden you're doing a lot of activity or you build your muscles up and this enlarges, it could start causing compression issues and you might have sort of the same problems as you had before. I know that happens in some people. I have a friend that had this ulnar nerve transposition submuscularly 15 years ago, and now because he's a writer, he spends a lot of time on the computer, also likes to work out, play soccer and stuff. He was getting some tingling again after 15 years of being pretty good, free, problem free. But so I kind of said, all right. He wanted to like get me on the books right then and there. I just told his assistant that I needed to check my schedule and I just really needed to get another opinion because I don't want to just take his word for it. So I had another appointment set up this past Wednesday, I think. I met with another surgeon, and he had a pretty busy clinic. It was just him and another doctor. I waited like 2 hours to see him. It was crazy. And frankly, like by the time you wait that long, you're just like over it. I didn't even. It's a good thing my wife was there because I was just like, whatever. Yeah, I bet my arm it hurts, this and that. But the assistant usually comes in and you tell her, how it hurts when you're doing what, and how long you've been having the problem, and those sorts of things. And then they usually come in to make the decision or take a look at you. And funny enough, I have all my notes together that I bring. I mean, I have like a packet of stuff right here, and I have my images, on a few discs that I keep in this envelope because they mail them to me. But the funny thing about that is that if you don't have images and you go in to see these doctors, they'll most likely say, oh, well, we need your x-rays. Well, we need to do an x-ray to know what's going on. Then they'll charge you $40 or $100 or whatever your insurance costs. And then a lot of times they'll come in and they'll just talk to you. They won't even mention the x-ray. I've had that experience. I went to see, actually, I mean, he was a good doctor. He was at Kerlan Jobe in Anaheim, like the kind of famous orthopedic surgeons that do a lot of the athletes. And I did x-rays, and I remember him coming in and he didn't talk about them, So it's like, well, there went $100. So the funny thing about that I'll say is that when this doctor I met with on Wednesday came in and talked to me after he left, my discs had been sitting on the table the whole time since this assistant came in. So it was clear that he never looked at them, unless he can look at a disc and see what's on it. But whatever. Just do yourselves a favor and keep your records with you, so it'll make things easier to go from doctor to doctor. Another little recommendation. When I met with the neurologist and I was trying to figure out what was going on, and we did nerve conduction studies, we did like the nerve conduction velocity test, like the NCV nerve test, and then they'll do an EMG test other times. Um, had all those done, and he recommended, go see a surgeon, see if it might be time for you to have surgery. That was at the point where I had this for about, 4 years, and I'd long tried conservative treatments that, when I was out of work for almost a year, actually a lot of my symptoms went away, but it wasn't until about a year ago where I started working full time again and typing and mousing around that things came back with a vengeance. But anyway, so I was going to see orthopedic surgeons that dealt with the elbow and this and that. I heard people say go to a hand surgeon, but then I thought, well, every time I see a hand surgeon, all they do is talk about carpal tunnel on their website. But they're actually the people that handle this kind of stuff the most. They're typically the ones that are doing cubital tunnel and carpal tunnel surgeries on a regular basis. The orthopedic doctors still do some ulnar nerve stuff. Like the guy I went to at Curl and Job, he did a lot of Tommy John surgery for the pitchers, and as a component of that, they'll move the ulnar nerve sometimes, but they're going in and fixing other stuff, and then the ulnar nerve is kind of like part of that. It's not, the sole reason. So hand surgeons are what you guys should be trying to go see. And trust me, I was like, do you guys do cubital tunnel? And they're like, oh yeah, that's the second most common nerve entrapment thing. So anyway, I went in to see this hand surgeon on Wednesday, and he talked to me about blah, blah, blah. And, he also agreed that I needed surgery at this point, and was kind of alarmed that I waited so long. And he told me something I don't think I'd heard before. Maybe I heard it from one of the other surgeons, but basically said, like, your nerve tests for cubital tunnel aren't really as helpful as they are for maybe carpal tunnel and those sorts of things. He said, you could have no symptoms and then show a positive sign on your nerve test that you have slowing of the nerves, or vice versa. Like myself, I only have slightly slowing on the nerve tests, but I have a lot of the pain and not tingling and stuff. So he also he explained that there's a nerve, and inside the nerve there's motory sensors and sensory, or motory fibers, let's call them, and sensory fibers. So I have pretty good motor fibers because I can still have strength in my hand and whatnot. My sensories are all jacked up. Like, it's hard for me to pick up something really precise when these are tingling. I mean, I notice when I drop something flat on the floor, it's difficult for me to pick it up. But anyway, he said, I should get it done, but he told me that I should try doing decompression surgery, and that's where it's less invasive than the transposition because they leave the nerve alone and they just go in, they make a small incision here, and he actually uses an endoscopic procedure where they use a camera and they just free up this path along the ulnar nerve here and here. And he said, that might cause me or give me some relief. And the first thing I said to him was like, well, what about my nerves subluxating out of the groove? And he said, oh, your nerves subluxate out of the groove. So, he puts his hand here and has me bend my elbow like this. And, like, I don't know if you guys can see, but I can feel something here. I'll move my finger out of the way. I can see, if you look at this bone right here, I can see something coming up there, but it looks just like it's like a muscle or something, and I don't really feel something popping over. It's a little tender there. I went to the gym today and tried to irritate it on purpose, tried to see if I felt it popping in and out. And for me, when I bend my elbow like that, I don't get pain necessarily right away. It might get sore later, and I don't really get numbness right away either. So it makes it really hard for me to tell what exactly is causing it. He felt and said, well, maybe they're subluxating. And I've had doctors say, yes, they are. No, they aren't. I can't really seem to get a consensus on that. The majority say they are. And I think if they are moving around at all, most doctors go, oh, you should do the transposition, because if you decompress it, and this was what I also said to him, wasn't it going to, if you free up the nerve in this area here to move around more, isn't it then going to just move easier back and forth over here? And he said, well, maybe, but a lot of people live with the subluxation, and sometimes that's not what's causing the problem anyway. So, needless to say, it just created more questions for me than it did answers, because I got, and then when I told the surgeon on Wednesday what the previous surgeon had told me to do with the subcutaneous, he says, oh, no, you would need to do submuscular, you're too lean, there's not enough fat there, I wouldn't do that to you. And then, I kind of brought up the subluxation again, and, I didn't know if that was a big deal or not. And he said, even if you have subluxation, I would still recommend doing the decompression first, because if you do, the decompression and that doesn't work, you can always go back and do a ulnar nerve transposition. That's just Amazon. I can see the FedEx guy or something, I think it was. It looks like he's wearing a beekeeper's costume. I don't know what the hell that is. Really weird. What in the flying F? Whatever, sorry. But yeah, so that part makes sense, doing the decompression first, but then you're like, well, if I go through surgery and I do that here, and then I have to do another surgery, why not just fix it right off the bat? If decompression worked, and I would be super excited, because that's a way quicker recovery time. I think it's only like a month before you're pretty much back to normal, because they're not, it's not a big incision, they're not carving up any of this muscle, they're not moving anything. It's just right here. It's very similar to like a carpal tunnel surgery, and people recover pretty quick from that. So I'm kind of considering that. I'm going to see another surgeon, because right now it would just be like flipping a coin. I don't know who's giving me the best advice. My one concern is if I get the decompression, then it'll move more over the bone. And I've always tried to, and this is my best advice to you guys, is try to figure out what's going on in your own body. I know it's hard. It's super frustrating. But the surgeons, from what I can see, they all recommend what they're comfortable doing. It's not necessarily what's best for you. You kind of have to figure that out. And I know that's screwed up, because we don't all have medical degrees, but it really is, because if I go see the guy that normally does transpositions, he's going to go say, do the transposition. If you go see the guy that I saw in the middle of this week that does all decompressions, he's going to go have the decompression. So, and I know probably when I see this next guy, I think he's a transposition type of dude, he'll just recommend that. So, it's hard. And I feel like, obviously if bending your arm is causing you pain here, and you can determine that, then that's pretty, much likely your ulnar nerve is subluxating, and that's causing the tingling and the pain. Again, like I mentioned before, mine's not always right away. I'll go to the, like for example, before I went to the doctor, I went to the gym that day and worked out. I came home. I never washed my car myself, because it's labor intensive and screws with my arms, but I figured, what, I'm gonna wash it, I'm gonna wax it, because I'm gonna go to the doctor tomorrow, and if everything's kind of bothering me, it's perfect timing. But you know what happened? I did that. I went to the doctor and I felt fine. I didn't even have a problem. So, and then a couple days later I started to feel crappy. Like, I went to the gym this afternoon, I felt okay afterwards. I really did. And then once I started mousing around on the computer, doing this, my hands start doing it. So that kind of, and it's hard though. It's like, if you're mousing and typing, like that's what gave me a lot of my problems or brought them on, that to me sounds like a compression thing, because you're activating all those flexor muscles in your forearm and whatnot, and you're compressing the nerve. So I'm getting tingling and numbness because I'm moving those around. That to me seems like a compression thing. But it also could be that I'm bending my arms in my daily life. Like, for example, I just went to the gym. I'm bending my arms. I get back from there. I feel good. but then I start mousing around on the computer. Maybe that bothers me because I just bent my arms a bunch, and now when I move, I'm activating that nerve, and all of a sudden it's already irritated, so then I get tingling. I have no idea. I mean, I would really love to hear from you guys about sort of what happens with you. Do you, if you're working, if you're a person that works out, do you feel pain and tingling while you're working out? Is it something that comes on later? Describe the activities to me and let me know. I'd be interested to hear. Um, I would venture to guess that a lot of you have the same type of thing as me, is it's just hard to pin down. And I think because of that reason, I'll probably have to have the transposition, um, unless I want to just kind of roll the dice and try the decompression to see if it works. But it'd be pretty frustrating to go through that and then come out and just have no relief and have to do the other. Then it just adds another month on or whatever. I don't know. But anyway, so I also, I've been doing a ton of research, trying to find if people had ulnar subluxation, got decompression, did it make it worse, better? I've read studies that say, you know, people got the decompression and it worked out okay. I've also read things that like they didn't do the decompression because there was subluxation. Um, sometimes like the second one that surgeon I saw said, sometimes you get subluxation. And, I read a statistic in one of these medical journals that I think it was like 15% of the population or almost 20% has some degree of ulnar subluxation, but doesn't have, only a fifth of those people have a problem. So a fifth of the 15%. And the rest, I don't have any of the symptoms. So I guess it just really depends, but it really makes me suspicious. Like if something's moving around here, it's probably most likely causing an issue. I think with this neck surgeon, I read online a lot of people recommending getting a ultrasound, and they can actually hold up the ultrasound and have you bending your arm like this and seeing if it's popping out. Like when I'm doing that, it's sort of aggravating it. I feel like it's tingling, but then again, it's kind of tingling from the mouse, so who knows? And like I said, maybe it's because I went to the gym and I irritated it, and now when I bend it, it's kind of irritable and I'm feeling the effects more. I have no idea, you know. I really welcome you guys if you come across this video to share what's going on with you. Also, anyone that's had decompression that comes across this video, let me know how that's worked out for you. I've been trying to find videos on YouTube that talk about decompression, and I haven't been able to find much at all. Only a few women talking about it, and I was really more would like to hear from somebody who's more active. It seems, I've read another article that was saying maybe decompression's better for people that aren't as active, because the thing with that is, you're still the nerve is still being stretched when you bend your arm. So even though it's decompressed here, it's still being stretched, and even if it doesn't subluxate. So if you're doing things that repetitively bending your arm, or you have your arm bent for a while, you still could have problems. And I think the recurrence is higher with the decompression. But again, it's like the attractiveness of that being an easier fix. It's awfully tempting. I think a lot of this, when I think about what's causing my issues, is probably wishful thinking for me, thinking it's just the compression and the subluxation's not causing anything, but it probably is. But I'll let you guys know after my next. It's 2 weeks from 2 weeks from today. 2 weeks. I think it's like not next Thursday, but Thursday after that maybe, that I see the doctor. I wanted to see the other doctor at the place because he was seemed like he had a better experience, but it was until like the day before Thanksgiving that I could see him. So I'm gonna see this guy, and hopefully, if I'm still on the fence, I'll see the guy that works with him, because I think his opinion would be really good. But again, I hope that helps. I know I'm just more confused than ever. It's just as frustrating now, and I was all set to just say, okay, I need this transposition and bite the bullet and do it, and now I've got, do my nerves subluxate, should I get the decompression, should I get the transposition, I don't know. I don't know. I'm just going to do more research and see more doctors and see if I can get a consensus, because I want to feel like, at least. And again, like I told you, it's probably going to be whatever the doctors do on a regular basis, they'll recommend. So I don't even know how much of it's geared towards my benefit. But again, that's why I think I'm going to ask for the ultrasound. Hopefully they'll order that up for me, because I think that would be helpful, at least for me to see it and know, okay, they are subluxating on each side. It might be easier to go, yeah, let's just do the transposition and not bother with the other thing. So anyway, guys, hope you guys are doing good. Hang in there. Know that you're not the only ones dealing with this. I know it doesn't make it any better, me bitching about my problems, but I know it helps me to hear from you guys and know that there's other people dealing with the same thing, and hopefully we can help each other out. I know as we kind of discover more about this, it just doesn't seem like the doctors know much about it. It really doesn't. It seems like they've been doing the same procedures for a long time. But I'll give you another update when I have my next appointment with the surgeon. And if you have any questions, let me know. I'm pretty quick to answer them. I do answer any questions that you guys leave. And again, if you had decompression and you're doing better or worse or whatever, let me know. And let me know just about anything else with your conditions or questions. So hope you guys are doing well, and I'll talk to you in 2 weeks. Aloha.